Bromhidrosis is a fancy word for strong body odor that usually comes from the armpits, feet, or groin. It happens when sweat mixes with bacteria on the skin, making a smell that can be embarrassing. Think of it like a kitchen. Sweat is the water, bacteria are the cooks, and the smell is the dish they create. The main cause of bromhidrosis is the bacteria that live on our skin. When we sweat, the bacteria eat the sweat and release smelly chemicals. Other reasons include having too much sweat, hyperhidrosis, eating strong-smelling foods like garlic or onions, hormonal changes, puberty, menopause, CERT medicines, and medical conditions such as diabetes or thyroid problems. Imagine a garden. Too much rain, sweat, and weeds bacteria together make a strong smell. People with bromhidrosis notice a noticeable, often unpleasant odor coming from the underarms, feet, or genital area. The smell can get worse after exercise, when it's hot, or when feeling nervous. Sometimes the skin feels wet or sticky because of extra sweat. You might hear someone say, "I can smell something after you exercised," which is a typical sign. Doctors usually start by asking about hygiene habits, diet, and medical history. Then they examine the affected area. They may take a small skin swab to see which bacteria are present. Treatment focuses on reducing sweat and killing bacteria. Daily washing with antibacterial soap, using strong antiperspirants, applying topical antibiotics or benzoyl peroxide, and in some cases taking oral medicines. For stubborn cases, doctors might use Botox injections to block sweat glands or laser therapy to reduce the amount of sweat-producing skin. To keep bromhidrosis away, wash the skin at least once a day with a gentle antibacterial soap and dry it well. Think of patting a towel instead of rubbing. Apply an antiperspirant at night so it can work while you sleep. Wear loose cotton clothing that lets skin breathe, and change socks and shoes daily. Cut back on strong-smelling foods and stay hydrated, because water helps dilute sweat. Simple daily habits act like regular cleaning of a kitchen, preventing the bad smell from forming. New research is looking at the skin's microbiome, the community of bacteria that live on us. Scientists are testing probiotic creams that add good bacteria to outcompete the smelly ones. Laser and light-based treatments that shrink sweat glands are becoming more popular and less painful. There are also new deodorant formulas that use natural plant extracts to quietly stop bacterial growth without harsh chemicals. These advances aim to give people gentler, longer-lasting ways to control bromhidrosis.